Turn it around. Hi, it's Craig Rubinstein, and I'd like to thank Trish for inviting me to talk about Mummy Makeover, wound management and post-op care. So if anyone can hear me, please ask questions and I'll answer them to the best of my ability. Well, while we're starting, there are just a few comments I'd like to make. My practice is entirely women. It's breast and tummy. We have 6 surgeons, all of who super specialise in various different aspects. So mine is breast and tummy. And I just want to make the point that real men don't use the word mummy. So we're going to use the word mummy makeover because that was a request, but mummy's not a word that I'd use. So in terms of what we can do, in terms of breasts, just before I get any questions, we can make them higher. We can make them, well, not lower, no one's going to do that. We can make them bigger, we can make them smaller. But what a lot of women want to do is they want to restore what they had prior to children. And that can be via a combination of augmentation, lifting, reduction, just depends on what's appropriate. And similarly with tummies, an abdominoplasty or a tummy tuck is removal of the excess stretch skin, which is usually most of the stretch marks. It's repairing the underlying split muscle. That's called a rectus divarication, because rectus muscles are the muscles that go up and down the tummy, and divarication means split. So rectus divarication simply means a split in the muscles. And if you're not sure if you've got a rectus divarication, there are several things you can do. One of them is lie down comfortably on your back and do a straight leg raise. When you put your fingers just above or below your belly button, you'll feel a split. So you can check and feel that in a tummy that hasn't been split, then you really shouldn't be able to feel a split. But once you've had a few children, so you can do all that testing. Or the other thing is, if you've had 2 or more children, I'd say 80, 90, pretty close to 100% of people have a split. And women who have had twins, I can't say I've ever seen someone who hasn't had a split, because that obviously just parts that muscle. And repairing that muscle is a very important part of the surgery, because it not only puts the anatomy back where it can be, which you can't do by yourself, it makes you more comfortable. There are some benefits. It can even help with a bit of incontinence, back pain, so there are a lot of benefits. So I'm waiting for some questions. What do we got here? I can do wave, wave, wave. All right. So hello Trish, thank you for inviting me. And there are lots and lots of questions. In fact, while we're waiting for people to post questions, I might even go through, because I've already got a list of people's questions here, and I'll go through them, and hopefully the people who posted them will get some benefit, but other people as well. So the first question is, how much does a body lift actually lift up excess skin on the bum and thighs? I have excess skin or saggy skin on my butt, but I've heard a body lift might actually help to tighten that skin up a bit. Well, a body lift will tighten the skin on the bottom and the thighs, but a body lift is a pretty specialised procedure. I don't personally do them. I do many of the components, but we do have specialist breast lift surgeons here. So what I'll be talking about today is more in terms of mummy lift. So that will be breast lifting, breast reduction, breast enhancing, tummy tucks. So I'm sorry if I haven't answered the first question too well, but that's not what I do. This is more tummy tuck. What else have we got? Are you always able to move a belly button or create a belly button when it's lost in so much excess skin? I've heard some patients end up with no belly button because it dies or something. An abdominoplasty involves removing all of the skin and fat from somewhere in the hairline, which, as we know, most people don't have these days, but where the hair would be, and going to somewhere above the belly button. So all that skin and fat is removed from the outside. And then the belly button, which comes up like a chimney, the belly button's actually left. So we leave the belly button, we cut around the belly button, leaving the belly button. Then all the skin and fat above the belly button is lifted up, not cut away, but lifted up to the rib line. And that way we get good exposure to the deep underlying muscles, and those muscles are carefully repaired. And when I was a medical student or a junior trainee, I was taught to put a few interrupted stitches, so we'd go a few cross stitches. What I've been doing now for probably 15 or more years is to do a continuous stitch, and it's a very heavy non-dissolving stitch, so it's there permanently. And the reason that I do a continuous stitch is because most people know that when their tummy's stretched up from babies, it's going to be stretched in a horizontal way, but it's also stretched in a vertical way. So by doing a continuous suture, in other words, starting from just below the ribs and going round and round and round down to the belly button, tying it off, and then doing another one from below the belly button down to the pubic area, it tightens the tummy both in a horizontal and a vertical direction, so it gives a much better, stronger repair. So once, it's probably easy to demonstrate or draw, but once all the skin and fat from below the belly button to the pubic line has been removed, the belly button is left, the muscles repaired, then that top half of skin is then pulled all the way down and it's stitched down, and it does stretch. There are ways of doing that. So once it's down and it's stretched, that's the lower, if the skin is repaired down below, so there's a scar that goes low, usually just below where a Caesar scar would be from hip to hip. There's no scar above that. And then where the belly button would now be completely buried, as I say, like a little flower under the snow, because the skin has been pulled over it, I make a little smiley face and bring out the belly button. And it's interesting, when we were taught to do abdominoplasties, the belly button's circular, so you cut them out circular, make the hole circular, and you bring them out. But when you look at a really nice belly button, in fact it's not circular, it's almost not quite heart-shaped, but there's a little hooding at the top, and it comes in a little bit. So there are ways we can make it look better by removing a little cone of fat from where the belly button should come out. And so that the belly button, we also angle it a little bit, so instead of looking straight into a hole, it looks nice, it looks very natural, and the scars are hopefully inside so you don't even see them. And in terms of belly button dyeing, in fact I did see recently where a surgeon who didn't do very many did have a dead belly button, and that can occur, but really a dead belly button is pretty bad. It's not fixable, it looks terrible. Now, having said that, as a plastic surgeon I have actually built belly buttons, because when I was a trainee, the general surgeons used to do them, and the belly buttons often died or they didn't even put them, but a belly without a belly button looks terrible, so we always make them and we can create them. Now it looks like I have a question here. I just saw an article today saying that we can't get more than one procedure done at a time. Now, is that true? No, it's totally not true. It's completely not true. I won't do two massive procedures together, because I think the risks and complications do become excessive. And as I tell all my patients, whilst your happiness is very important, your safety is more so. And as a member of my family, that's what I would insist on. So generally my procedures don't go over 4 hours. Most of my procedures take 2 hours. So a tummy tuck might take 2 hours, a breast reduction or lift or implants as a combination would take 2 hours, so that would be 4 hours. If it was going to be much more than 4 hours, I'd do it staged, but certainly we frequently do procedures together. And that's actually important, because an enhanced breast can de-emphasise the tummy, and a lesser tummy can emphasise breast, so they're very complementary. And that's really the whole logic behind Mummy Makeover, that expression I'm very keen on, is we frequently do the two together. But safety still is the most important thing. And so what about an augmentation with a lift or reduction and lift? Well, augmentation with lift is called mastopexy augmentation. Mastopexy means lift augmentation, and it's actually surprising. It's a very difficult operation. I do a lot of them. Many surgeons won't do them because it is technically difficult. Some people always do them as staged, but as with all consultations, all the options will be gone through in absolute detail. But for those people who want the two together, I'd say 90-95% or more, I do the two together. There are some advantages in doing them staged, for example, doing the lift and doing the implants later, or vice versa, in that it's more predictable. But if you do them staged, you're looking at 100% reoperation rate if you want to think about it, whereas if they're done together, there is a reoperation rate and it can be 30%, so it's certainly not zero, but that means 70% of people don't need the second operation, so I would do them mostly together. And I'm aware that I think most surgeons in Sydney, in fact, interestingly, won't do the two together, but I've been told that's because they're driven by Instagram and Facebook and they want everything to look perfect, which I don't believe is the appropriate indication. I think the reason for doing surgery is safety and the patient's best interest. It's not catering to social media, because you can see clearly I'm very familiar with social media. I'm still learning. I'm not a bad surgeon, but social media is something I'm learning. And reduction and lift, again, that is also not an infrequent combination. Generally, if there's a lot of breast, we may not want to remove good breast tissue and replace with an implant, but there are indications and reasons where that is done. So, Trish, I hope that answers your question. Okay, what we got here? We've got Emmy. Hello, Emmy. Hello, Rachel. All right. And now, whilst I'm waiting for more questions, I'm really worried about having another scar after a tummy tuck. I already have a huge one from where I had my cesarean. I've heard that you can have the incision made in the same place. Can you tell me if this is possible? Absolutely. So you can't actually make a cut just above the Caesar scar, because then you'd have two scars right next to each other. That's called tram tracking. There'd be no blood supply. So I would always go actually just a little bit below the Caesarean section scar. So although you would have more of a scar, you would just have one scar. And the aim of the scar is really to put it as low as possible. So as I tell people, if you're wearing bathes or bikinis or a skirt or an outfit, it actually should hide quite nicely. As I also say, if you walk around the house naked or in a G-string, then the scar will show. But most of the people I look after probably don't do that too often, which is, as I say, a pity, but beyond the scope of this conversation. But the scar does hide well. And also in our practice, we have a Fraxel, which is literally a $150,000 laser. We laser scars, we have dermal therapists, so we do everything to make the scars as good as possible. So we do that as good as possible. Okay. Can you explain the difference between a fleur-de-lis tummy tuck and a normal abdominoplasty or tummy tuck? So fleur-de-lis, it's actually pronounced fleur-de-lis according to a conference I went to, but fleur-de-lis sounds a lot nicer. So a fleur-de-lis is where a big ellipse or like a flying saucer shape of skin and fat from the below the belly button is removed, but also there's a vertical extension, a cone that goes above the belly button. And that would be for an extremely large tummy where we want to correct not only the not only the horizontal component but the vertical component as well. So that would represent a very small percentage. It's got a high rate of complications, wound breakdowns, but where appropriate it is provided. And a normal abdominoplasty or tummy tuck being the same thing is removing that flying saucer of skin from belly button down to the pubic area. But in combination with that, it's also, as I mentioned before, repairing the rectus muscles, which is very important. But also that is combined. I do liposuction. I use microwave powered liposuction to the upper central abdominal area to make that nice and smooth. I also usually do some liposuction to the mons or the pubic area, because otherwise there's a bulge, and frequently to the side. So tummy tuck, some people just cut a bit of skin and call it a tummy tuck. There's a lot more than that. To do it properly, it's quite an involved procedure. But that's what I do. And I did, for the truth, I did 3 yesterday. So it's a common procedure for those who do a lot of them. But if you're going to get it done, you'd certainly want to go to someone who does a lot of them and does them carefully. Because as with all things, the best time to get things right is the first time. Best way to get things right the first time, right person, right surgery, right reasons, because some things can't be fixed. And sometimes we see tummies and from elsewhere and they can't be fixed. All right. So we've got Chrissy, hello. Now, can you explain the difference between a fleur-de-lis tummy tuck? We've done that. The next one is, my boobs are super saggy after feeding 3 babies, but I don't want to have implants. Can a lift help? And do you do any fat transfer at all? So, as with all things, a breast lift can achieve some things and some things it can't achieve. What I tell my patients is a breast lift will give you an appearance similar to in a bra. So if you like the look of your breast in a bra, it will achieve that. If you want more than that, it won't. So think of a breast lift as an apple pie and taking a big wedge out of the bottom of the apple pie, putting the nipple in the middle of the apple pie, then closing the apple pie around the bottom. Again, it's easier to draw and demonstrate than it is to talk about. Now, it doesn't matter what you do, it's still the same apple pie. So it will not be firmer, it will not be fuller, it will not be bigger, and it won't be rounder. It can't be. So when people show you results with that's been done, it's either very early where they're swelling, or maybe they know something I don't. But I do a lot of breast lift. It's an excellent procedure with limitations. If you want fullness, firmness, and size, then the only way to achieve that is with an implant. Now, fat grafting, which someone has asked me about, is an interesting concept. I first heard about fat grafting 20 years ago, and I thought, this is excellent. But my reservations about fat grafting is that it is highly variable, and that most of the experts say at least 50% disappears. And I know that there's someone around town who, before fat grafting, gets them to go on a high-calorie diet, eating milkshakes and biscuits and chocolate and things like that. Well, that's nonsensical, because if you put on a whole lot of fat by eating a whole lot of food, which is not good for your health, what happens when you go back to your normal weight? It's going to disappear. And I've seen, in fact, that person presented quite recently at one of the conferences And if they're the best results, it wouldn't be enough to justify the procedure. So I'm not saying fat grafting doesn't work, and we have Dr. Rebecca White in our rooms who does fat grafting, and fat grafting has a role and she gets good results, but they're very conservative and they're very natural. So a little bit of fullness, a little bit of firmness, but if you really want round, full, firm breast, then currently the only technology is implant technology. And since 1962, that's come a long way. We have some new implants, which I'm very, very impressed with, which I can explain later depending on time. Rachel, thank you, Rachel. Bit of encouragement. What are we up to? So super saggy breast lift will achieve some things, not everything. It can be combined with an implant. But the other thing is too, as with all things with surgery, the aim is to do good surgery and not burn any bridges. So it's not that common, but sometimes I do a breast lift, go through everything, and sometimes that person might come back, because we see all of our patients till they've settled in every year, and that's all included. Because I've now seen people 20 years down the track, because that's what defines a good result. And sometimes people come back and say, you know what, I want to have an implant now. Or sometimes people come and think they want an implant and they don't. So they're all variations. But as with all things, at a proper consultation, which can't be done in 10 to 20 minutes on a forum, there's a lot of information. So when we see our patients, I see them at least half an hour, 45 minutes. We spend an hour and a half with my team. There's a lot of things that goes into it, because if you're spending 5 minutes with a surgeon, they're not doing you justice. So there's probably, for every hour of operating I do, and there's a lot of operating, there'd probably be 3 hours of preparation. I just lost 34 kilos, but I'm left with heaps of sagging skin on my thighs. But will the pulling up from a tummy tuck help? Unfortunately, there is a simple answer: no. So if a surgeon said, oh, maybe a bit, maybe, that's not true. He just won't do it. There are ligaments that cause fixation. He will not do it. A tummy tuck will fix your tummy. It'll lift up your mons, which is a good thing for lots of reasons. But if you want your thighs, that's not going to happen. That's a specific dedicated procedure, again, one that I don't do. A thigh lift has a role, but really all I do is, to be blunt, really is what I love doing, and breasts and tummies, because I know with the right person I can predictably get a pretty good result. But thighs, we have specialists who do thighs, we have specialists who do arms, but that's not what I like doing, and I just do what I like doing because I think you do better work. Now, next question is, do I need a belly button? It's an interesting question, because the function of the belly button is, well, obviously in utero to feed the baby. But when I was, as I mentioned earlier, when I was a trainee, in fact, before I got into the plastic surgery training program, when general surgeons used to do abdominoplasties, they often didn't put a belly button back, and it just looks weird. It just looks seriously, seriously wrong. And as I mentioned many years ago, I actually had to build a few belly buttons with little skin grafts and everything. So you don't need a belly button, but it's like, does a breast need a nipple? Well, actually, the truth is it does, because it looks ridiculous. So yes, you do need a belly button. I've seen some infections and wonder if I even need one. Well, if the surgery is done carefully and properly by a very experienced surgeon who doesn't rush and does careful work, then minor infections are not uncommon, but they settle promptly. Major infections are very, very, very rare. So I would say not having a belly button would not be a good idea. All right, who have we got here? We've got Trish, we've got Kylie. All right, now, are there any more questions? Christy says, bless you. Christy, thank you, that is lovely. I've been consulting all day and my head is going round and round in circles, so I'm sorry if I don't look as dynamic and fresh as I might have done this morning. It's been a lovely day, but it is good. So, you know, and I was operating late yesterday, so that's enough. All right, are there any more questions? All right, so maybe I'll just talk a little bit. So what are the effects of having a baby? Well, probably the worst is when they grow up and become teenagers and wreck your life, but they're probably worth it. But the obvious ones for a mum are breasts will swell, get bigger, particularly with breastfeeding. And a lot of women actually really like that look, that round, full, buxom, feminine, womanly look. And sometimes even they try and prolong the breastfeeding with the expectation, but the problem is once that milk dries up and once the breasts go down, then they literally go down. So there's droopiness and loss of fullness. And again, they can be addressed depending on what your priorities are. Implants for upper pole fullness, roundness and size, lift for elevating the nipple, tightening up the lower pole, combination of doing the two. I'm Julie, I'm getting sympathy. Oh, you poor thing. I hope I'm not that bad. It's not that bad at all. Mind you, if I was going to say if I was operating, it'd be different. From Emmy, thanks for doing this. Look, Emmy, I hope this is helpful for you. I could talk for all these topics for hours, but what I'm trying to do is be a little bit more specific and answer specific questions. So in terms of breast, another question I frequently get asked is if I have either breast reduction or breast lift or breast augmentation or combinations, will I still be able to breastfeed? And I'll address those. In terms of breast reduction, it's interesting in the past, again, I'm going back from when I was a medical student, what we were taught is when women came to us for breast surgery, we'd sort of pat them on the head and say, look, you go away, dear, and have your family and come back afterwards. Well, firstly, I've never patted any on the head ever. I think I'd get my head bitten off if I did that. And secondly, I don't think that was good advice, because for women who've got excessively large breasts, which would be probably one of my most popular procedures, they get neck pain, back pain, shoulder pain, bra grooving, men staring at them, can't buy bras, can't exercise. So a breast reduction, I'm doing more and more young people. I mean, they have to be mature, both physically and mentally, and support of their parents if they're very young. But it's an excellent procedure, and women just get on with their life. Same with breast lift and breast augmentation too, same. So to put into perspective, I've had many women who after each of these surgeries have been able to breastfeed. And interestingly, many women who've got very big breasts often can't breastfeed because they either smother the baby or don't produce milk. So we can still breastfeed, and pregnancy changes everything. Now I have a question here, can breast and tummy surgery be done at the same time? The answer is absolutely, and they're frequently done together. But again, if I have a massive tummy and huge breast, then it may not be safe to do so. So we may do it as a staged procedure. But I would say that would be quite a common procedure, and they're both complementary because more proportionate breasts make tummy de-emphasised and vice versa. Hello, Craig. Do you need a tummy tuck if you have loose skin or lipo, or is there no surgical things instead? It's a very good question. What I tell everybody is basically nobody needs anything. I mean, a lot of the tummy tucks I do on women, as I say to them, if they'd been born 300 or 400 years ago, they'd have been perfect, because what we all wanted was a tummy where, to be a bit crude, if there was a crop failure or a long winter, women didn't starve to death. So I think fashions nowadays are a bit unrealistic. And keep in mind, particularly with social media, there's a lot of dishonesty. I saw a YouTube where a woman in her early 20s, I'm guessing with no kids, who had an absolutely perfect body, she looked gorgeous. On the computer, they made her eyes wider, her cheeks flatter, her legs longer. So what you see on the internet, what you see on YouTube and Facebook, and even what some, I was going to say surgeons, some of these people are not even surgeons, doctors post of what they achieve. I just wonder how realistic they are. How long before I can go back to the gym after a tummy tuck? I'm extremely active and do a mostly high intensity training with cardio and weights. I like to get people mobilised and getting going early, so I'll backtrack a little bit on that question. For all my patients, I like them to get up the next day. They can have a shower, they can wash their hair, they can have a cup of tea, they could have a glass of wine if they wanted to. In fact, there's no medical reason they couldn't drive home, but common sense and insurance says you won't drive after a tummy tuck for probably a few days to a week or so. In terms of going back to the gym, within a few weeks to a month or so, you can do some light, gentle, lower body work. So it's a bit of walking, some light aerobic. If you want to do super duper heavy tummy work, I really recommend you don't do anything for about 10 to 12 weeks. And the reason is I'm doing a very strong, careful, important repair to those deep split muscles, and collagen takes 10 to 12 weeks to become strong. So if you were to really overdo it, and you'd really have to do it, you wouldn't be doing anything dangerous, but you could undo the good work. And again, it's not like you do nothing, then at 12 weeks you do the Boston Marathon. It's staged. We see all of our patients a lot. We really see them a lot. It's all included. So for each person, we customise it. Some people can get back to exercise a bit earlier, some a bit later. But keep in mind too, if you're going to have the benefit of this for the rest of your life, just a few weeks or a few months to do things safely, carefully, and get it done. And Julie says, absolutely, it's the best thing I've ever done for myself. Julie, that is lovely. Thank you. I'm very glad everything's gone well for you. I think the right person having the right surgery done by the right time and everything, it is, and that's what all good surgery should be. It should be life-changing in a positive and beneficial way. And I feel really sad when people go to basically cheap places or Thailand, third world countries like Sydney, because when they come here, it's really difficult to fix them. That was a joke, by the way, of the Sydney bit, but I wouldn't go to Sydney. I'd come here. And Emmy, Trish, I was just about to ask, wound breakdown and nutrition. I think nutrition is important because that's the way the body heals. So common sense diets, not binging on anything. If you do drink alcohol, just keep it to moderation. and just keeping up your protein and your micronutrients. And we actually help you. We actually, at each step of the way when we see you, we give you little packs and packages and advice and cards. So we actually give you the macrobiotics, and we give you arnica, we provide all those things. We even provide the bras post-breast surgery, because it just means you get off to a good start. All right, another question. What do you recommend for scarring? Well, the biggest dictation of scarring is probably your parents, which you can't really do anything about. So what I say is, if you get a good scar, thank your doctor. Bad scar, blame your parents, which is not entirely true. But given you can't do much about your genes, well, not at least at this stage, having a good surgeon who adheres to good surgical principles, so not too much tension closure, using deep buried dissolving sutures, careful apposition. Again, as part of all of our post-op protocols, we see people a lot. I think I mentioned that. It's really important. That's all included too, actually. And we provide Fraxel laser at the 8-week point, between 8 and 10 weeks, and that's all included. Silicone gel sheet for some people. I now provide everyone with an oil and show how to just massage that in. So it's a whole combination of factors. It's getting the right surgeon, doing the right surgery. Surgical technique I could talk about for hours. And then post-operatively, laser if it's appropriate, IPL if it's appropriate, dermapening if it's appropriate. It really depends on your skin type, your scarring. Sometimes we even inject with a bit of steroid. There's a lot of things. But in terms of what you do, we give you the tape, we provide you, and each step of the way there are instructions. So doing the right thing. Melissa, hopefully that was helpful for you. From Louise Wilmer, what's an apronectomy versus a tummy tuck? Very new to this. An apronectomy is really just removing the excess skin. So it's an apron of skin that hangs down. And the biggest apronectomy I've ever done was actually 9 kilos. It was many years ago. It was a Kiwi. It was just huge. And that was an apronectomy. An abdominoplasty is an apronectomy, plus, if I do it, generally liposuction to the upper tummy, plus usually liposuction to the mons or the lower area, often liposuction laterally, repairing of the muscles. So an abdominoplasty is an apronectomy plus a lot more. When does it stop hurting after muscle repair when you sneeze? Well, it can take a bit of time, actually. As a surgeon, we generally underestimate how long things take to recover, because when patients come in, they put their lipstick on, they put on a brave face, and they say everything's fine. But tummy tucks are pretty, if it's done properly, that is. I mean, I've had people complain that it's sore, and I say, well, if it's done properly, we may not be friends for a few days, but if I cut a bit of skin and you're not sore, then you're still not going to get a good result. In terms of sneezing, I would hope, well, hopefully well within a month or two. But generally, when you wake up, you should hopefully be fairly comfortable. This is straight after surgery, because firstly, we're very mindful. We put a lot of blocks in, so I put local anaesthetic in the rectus sheath. I do blocks of local anaesthetic. We have really excellent anaesthetists. So I would hope when you wake up, it should be pretty comfortable. In fact, we want you to be comfortable, because it's a nice thing to do. But if you're uncomfortable, your blood pressure goes up, you can bleed. So from a safety point of view. But until you feel good about yourself, if a tummy tuck is really done well, that can take quite some time. It can take a month or two. So it can certainly take a while. And for the numbness and all things, that can take 6, 12 months, 2 years to settle. But mostly things get better and they continue to improve slowly for a long time. From Louise, lost all your weight and thinking about it. Look, Louise, I think the thing to do is get proper information from a person who gives you correct and truthful information. If you're in Melbourne and you want to come and see me, I'll be delighted. And I think it's probably not a bad idea. Go and get 2, 3, 4 opinions. For one of the most important decisions of your life, whether you want to come to me or not, or whether you want to come to our group. I mean, you'd be welcome. But in fact, I'd come here. But go and you need to find out who you believe will give you the best result, who you get along with. We're not for everybody, but I think we do good work and we're careful. And if you feel comfortable and it's appropriate and you're given good advice, and it's the base of a good journey. Because really, surgery is a journey. It's not an end point. Tummy tuck's not going to even give you the result you want necessarily. But what I like to tell people, it'll turn you around. It'll give you a big push in the right direction. It'll give you a second chance. What you do with that second chance, that's up to you. Because remember, as a surgeon, I can address what's on the outside and a lot, but what's on the inside, you have to. And that's why we work together as a team. Everything we do as a team. Another question, do you use compression after tummy tucks? We do. In fact, we provide them. We provide everything because that way it's just done. I believe that a little bit of gentle compression is probably good for you. I'm not 100% convinced, but I think it probably helps a little bit, and I think all the little bits do add up. But we provide girdles, we provide binders, we provide everything. It's just easier that way. But very, very tight binders are not a good idea because they can cut the blood supply and stop blood coming back. So gentle, appropriate compression is good. I think I can see the bottom of questions is why do you do Fraxel after surgery? Because it gives better scars, and everything I'm doing, well, actually after safety and happiness, is to do with giving better scars and better results. So we do absolutely everything. And some people respond well to Fraxel, some people don't. It depends on your skin type. There are a lot of things. If there was a simple cookie cutter approach, we wouldn't do what we do. We just sort of operate. But as I said for every hour of operating, there might be 3 hours of preparation. That might be too far off. That's probably about correct. I mean, I don't spend 15, 20 minutes or more marking you before surgery. I mark, I measure, I check, I calculate, I stand you up, I lie you down, I measure it again, I use a laser level, I photograph it. If you're going to do good work, that's what you've got to do. Would you do back fat? Like cut out a wedge at the back where there's heaps of loose skin? Well, look, I do it occasionally, and there are some people, generally I wouldn't do it in isolation. If I've got a patient who's had a tummy tuck and it's got a good result and they want to do a bit more, I often go back and do a little bit more surgery. When I say often, I don't know what the percentage is, but I do it, and I don't charge for that. That's just finishing the job. So it depends on what it is. But what I really try and mostly to do, and I think we need to these days, is what I do a lot of. I do them to a careful, high standard, and things I don't do at all. Try not to. From Christine, do you have to have a muscle repair when doing a tummy tuck? I have a large apron I want removed. I don't want the full flat model tummy. The answer is you don't have to do anything, but the repair of the muscle, it's a bit like sucking your tummy in. It'll just give you a much better result. But the functional points are it also puts the muscles back where they should be. So we get told, we don't promise, we get told it's helped with back pain a lot. It helps with incontinence, which is not an infrequent problem. So we don't have to do anything. In fact, if I do a massive apronectomy, sometimes I don't do the tummy repair, the muscle repair, because I can do more. It just depends on what you need. So I go through all the options, and ultimately you decide what you want to do. You might even decide to go elsewhere, which would be a pity, but that's okay. But yeah, so we'll go through that in detail. Is lipo included with a tummy tuck? That's a good question, Trish, and the answer is yes. When we were trained, you'd never do liposuction, and I find if I don't do liposuction, I'm just not going to give you the best results. Liposuction increases the pain, it increases the recovery time, it increases complications, it increases a lot of things, but it gives you a much better result. So if I don't do any lipo, you'll get an average result, not a great result. If I do too much, you'll have a complication. So what I do is I invariably do liposuction, but I try to get it right, not too much, not too little, but sometimes I need to go back and do a little bit more, and that's not a problem. In the 3 tummy tucks I did yesterday, I think one person had 800 ml of lipo, one was, I can't remember, 400 or 500, I think one was somewhere around between those two. So I do. I don't want the FDL, which I learned recently is fleur-de-lis. The question's just disappeared. I'm sorry. I can't read the question, so whoever posted, please send it. I rarely do fleur-de-lis because what I find is if I do a proper, good, appropriate tummy tuck with the muscle repair and lipo, usually, not always can avoid a fleur-de-lis, which you really want to avoid because it looks pretty horrible. You have a big vertical scar which you can never hide under bathers or bikinis. Fleur-de-lis, it's an appropriate procedure, very, very limitedly, I think that's the word, but in the, I don't know how many lipos I do a year, but it'd be a lot. There'd only be generally one every year or two, so it's really not a common procedure in my practice, because I think if you can avoid that horrible vertical scar, A, it looks terrible, B, it heals badly, and C, you often don't need it. And from Louise, what's your name, whereabout are you? I'm Craig Rubinstein, and I'm at plasticsurgeons.com.au. That's plasticsurgeons.com.au. We're also cosmeticsurgeryforwomen.com.au, and we're in Hawthorne in Melbourne. So if you're in Melbourne, that would be good, but if not, you can come and see me. And there are good surgeons in other states as well, but if you're local, I'd come here. Can there be a smaller scar, from Kirsty? The answer is yes, we can always do a smaller scar, but if we do a small scar and you get a small result, then you've got the worst of both worlds. So there's what's called a mini tuck. A mini tuck, I think, is a great marketing term, but it's not a terrific procedure. And really what that is, it's just like a flying saucer or an ellipse of skin and nothing else. But with that, you can't reposition the belly button, you can't repair the muscle, and if you do too much, it pulls the belly button down. If you don't do enough, it's a waste of time. I do one every year or two, and it's a pretty average procedure. Any special info for bariatric patients in recovery? Absolutely, there's a lot of things with bariatrics. Now, the good bariatric surgeons are really onto this because, again, I went to a conference, I think it was 15, 20 years ago, where it was identified patients post-bariatric had much longer healing periods, higher complications, And I think that was probably largely to do with nutrition, because there is a variation of nutritional imbalance post-bariatric. So the good bariatric guys, they will address that. And also we provide you with vitamins and do those things. But it's getting good knowledge, and it's coming in and speaking to someone. Now, I've got Amber and Nick Moncrief watching, and Amber and Nick Moncrief are probably one of the best practices in Australia. So if you're around about their way, you should Google them. Nick is an excellent surgeon. He's a nice guy, and Amber's terrific. So plug for them as well. But it's actually true. They're very good. There are some people who are really good. Some people I'll be a bit careful of. Kerry, do I do tummy tucks on males? Look, I don't, Kerry. I really try and specialise, and I don't. We do have surgeons here who are extremely good, and they do tummy tucks on males, but I really don't do males, because I just really try and restrict myself and try and do the best possible work. And I think if I did too many different things, I couldn't be as specialised. Scars don't really bother me. Look, a lot of women say that, and again, the scars, we put them so they'll hide as much as possible. We do everything we can. It doesn't matter. People do say that to me. I'll always try and make scars as good as possible anyway, because I mean that's why we're plastic surgeons, to do things properly. What else? And Kirsty, thank you, Kirsty. I hope that answered your question. If you want to come and see us, you'll be very welcome to. And Amber sent me, I think it's a smiley face with love eyes. So I mean, job done. Yep, those guys are really good. I'm not just saying that there are some good people. Good. Trish says, love the Moncrief. I mean, okay, Trish, you don't actually have to overdo it. We like them. I don't love. Love's probably a little bit strong. And you wish you were in Newcastle. Well, if you're in Newcastle, that's where I would go as well. But apart from that, I'd come to Melbourne. Can you tell us about your surgery aftercare? Unfortunately, I don't have about 6 hours to do so, but it's really, there are a lot of things. You get seen every day in hospital, usually by one of my nurses, actually. Then when you come and see us, I see you. We take all the dressings down, we redo the dressings, we give you little packs, which have got everything you need. I actually don't even know what's in the pack sometimes these days, but it's got vitamins and arnica, and we give you all the tapes, we organise a laser, we provide girdles, bras, whatever you need. So basically, all you really have to do is turn up, and if you like what you hear and you want to do it and it's appropriate, then we do the rest. Can you tell us about your aftercare? That was what I just went through. Sorry, clearly I'm really au fait with this social media. And from Amber, thanks, lovely Craig. That's a pleasure. We say the same about you. Well, I would expect so. Thank you. When someone asks about who to talk to in Melbourne, I've got to see a person who focuses on something. Look, I think the world is such an unsympathetic place that you really want to go to someone who does a lot, who cares, and who's passionate. I know it's an overused word, but it's still true, and who's got the backup in the team. And I think the idea of going to just a person who does the occasional one, well, you'd be brave, which I wouldn't recommend. You want to go to someone who's part of a team, who's got backup, who's got lasers, who's got technology, who does things properly. Craig, does the neatest scars ever? Emmeline, thank you, darling. I don't know if that's true, but I will certainly take the credit. But anyway, thank you. That's a nice thing to say. I do really try. Is there an average price for a mummy makeover? What's the price of a consult? I'm not going to be evasive here, but I don't actually know what the average price is because it varies from person to person, and there's a lot of things that are all included. So, Monique, if I could ask you, please, if you ring my rooms, now the old number was 03 9429 8363. That's 03 9429 8363. We've gone digital, but if that'll get through, if you ring up or just get on the internet and they can give you some detail, but it does vary from thing. And the consultation, I think it's $200 now these days, of which if it's you have a doctor's referral, you get $70 back. But I don't charge for any subsequent consultations or reviews. They're all included for as long as I'm practice, and I think that's just good medicine, really. So we don't nickel and dime, we do it properly, it's all transparent, it's all above board, because it was me, that's how I'd like to be looked after. What happens if you get pregnant after a tummy tuck? How much can the skin possibly stretch? Look, excellent question. Of all the tummy tucks I've done, which have been a lot, as far as I know, there have been 2 people who did get pregnant. One of them was going to come back and do a bit of revision, and in the end she decided not to, and the other person actually didn't need anything. So, as I like to say, children wreck everything, and they really do, particularly the second one, but we still love you, Oliver. And that's true too, actually. But if you do have babies, they can stretch, which can be redone. But the common sense thing would be, if you're likely to have more babies in the future, you'd probably want to defer surgery. But if you were to get pregnant, it can be fixed. But again, all the ones I've done, the number I've had to fix is not very many. So Monica's on the Mornington Peninsula. But I don't want to dive into something not worth it. Well, firstly, we wouldn't let you dive into something. We don't dive into anything. We give you information and then you decide what you want to do. But Monique, if you want to come and see me, you might never want to see me again. I'd be devastated. But I think, if it's appropriate, I'll give you the information. I love education. I don't say things are good or bad. If they're bad, hopefully we just never do them. But if I can give you the information, you can decide. It may not be appropriate for you. And if it's not, I'll tell you. But ultimately, we give you information so you can make the best decision for yourself. Because keep in mind, everybody's a world expert these days, particularly on social media. And you want to go to someone who actually knows what they're talking about. From Carrie, hands down, best care, Aftercare. Well, thank you. I hope that is true. I believe it's true. Not alone at any stage. You even get a nail buffer file with gorgeous hand cream. Oh, I didn't know that. Well, that's me, one of the girls who did that, one of the many packs. Yeah, we do try and provide everything you need. I didn't know that you got a nail buffer. I hope it was a good one. From Christine, would you believe my phone cut out? Got the tail end. If anyone heard the answer, can you please inbox me what doctor said, so I'd be appreciative. Christian, I'm very embarrassed. I actually don't even remember what the question was, but if you repost it, I will answer it if I can. The phone number. Oh, actually, Emmy's done it. So this is the correct number because I'm still on the old one. In fact, I'd still use a rotary phone if it was an option. So Emmy, it's 0388491444. That's 0388491444. But if you get onto plasticsurgeons.com.au, that's plasticsurgeons.com.au, or if you Google me, then actually you really want to Google someone interesting, go Google my wife. She's a lot more interesting. That's Claudia at rubinsteindesign.com.au. She's an amazing artist. In fact, if you come to my rooms, the artwork is hers. People go, wow, did she do that? And I say someone did. But yeah, she's the talented one, which is true. And not because she's probably watching this, because she's probably painting, but she's good. From Claire, hi Claire. You can watch the Facebook Live later anyway. So if I haven't bored everybody, there's some information that is actually true. Craig was curious about the success of revision lipo. I have opinions. I'm not saying they're right or wrong, but they are based on probably several thousand or many thousands of cases. I'm not a fan of liposuction by itself. And the problem with liposuction, this is just my opinion, is that if you don't do enough, people are going to be disappointed. But the problem is if you do too much, then you're going to look like a balloon 3 days after the party. So you haven't addressed the skin. And given this topic is Mummy Makeover, where most people's skin is stretched, the number of times I do lipo by itself is not zero, but it's pretty close to zero. And I see a lot of lipos that have been done elsewhere. Someone's not even by surgeons or not even plastic surgeons, and they're unfixable unless we just redo the whole thing and cut it out. So I'm not a fan of liposuction by itself. Now, conversely, liposuction in combination with surgery, that's the best of both worlds. I love doing that, and that'd be 90% or more of my patients, I think. You can rewatch the video. From Maggie, hi, is it possible to do lipo with a thigh lift after massive weight loss? Lots of cellulite and excess skin and not as a stage procedure. Maggie, I'm not a fan of thigh lifts. I'm not saying they're a bad procedure, it's just not something I love doing. So all I do is breasts and tummies. You can do the combination, but again, keep in mind, massive weight loss, the problem is not fat, it's more skin. So if you take skin and you take fat, you could be in a similar position. So for contouring, liposuction is appropriate in combination. So you need to talk to someone who's an expert as opposed to me who doesn't do them. Breasts and tummies I'll talk about till the end of time, but you need to see a thigh lift specialist, and we have those in the room. So if you ring us, we can direct you to someone who does those things. Julie says, never boring. Darling, you just haven't been with me long enough, but I will take the compliment. Sometimes I even put myself to sleep, but there we go. Louise, do you do interstate consultations? Look, I'm not sure, which I think is probably no. I'm not a 2D sort of person. I like to talk to people and I like to be with them. So if you mean come and fly over and see me, absolutely, we see lots of people from interstate and overseas. So yeah, we do that. But if it's Skype, I'm not a fan of Skype. I need to be with a person so I can actually get a feel for them, and vice versa. So, but if you want to come and see me, you'd be welcome, and you can make a choice then. When would you suggest consultation after a weight loss surgery? 6 months stable weight and 6 kids? Absolutely. It sounds like you've done all the hard work. It's sort of people say, should I lose weight before surgery or after surgery? And there are pros and cons in both approaches. Some people have the surgery and then have the incentive to lose the weight, and then they lose more weight, in which case that's fine. We can do more surgery or not. So there's every combination and permutation. But look, when I was in public, and we all trained in public, and that's where we got a lot of our reconstructive experience, to be a bit cynical, when patients, when they didn't want to put people on the waiting list, they'd say go and lose weight, because if losing weight was that easy, people would have done it. So I don't get too stressed by that. As long as we work as a team, you do your weight loss before or after, I do my surgery, you might even lose a little bit more, and we can sort of work together. So it's a journey, not a single have a surgery, see you later. We don't do that. Booking consultation, will you tell me if you believe I can fix part of my body without surgery? Absolutely. If I can't do it, I won't do it. I'm not interested. There's no point. Are you honest, or will you just do what will benefit you the most? Well, I hope that would not be the case. But again, if I wasn't honest, then I'd probably give you the same answer. But I think you'll find that we're pretty straight down the line. In fact, I'd say we're probably a little bit blunt. So I'll tell you straight down the line. If I can help you, I will. If I can't, I'll tell you. But I think if you've got good intuition, when you go to people, if you go to a surgeon or a doctor who calls himself a surgeon and you don't feel comfortable and there's a little voice in your head that says, move out of there, then that's probably not bad. But the thing to do is, if you're not sure to do, come and see a few people. Come and see me if you want. I'd like to see you, see other people and have a think about it. But no, we're pretty straight down the line. Like I'd say, very. And Trish is watching. Now, anyone who doesn't know Trish has been my theatre nurse for 22 years. And she makes me behave, which is actually true. She's the world's best theatre nurse. Actually, we've got very, very good ones, and been as well, so I don't want to do that. But anyway, Trish is fabulous, and if you come to theatre, you will see Trish, because she has to be at my theatre list and has been for 22 years. Monique, do you offer payment plans? Look, one of the rules of APRA is we're actually not allowed to discuss that. Now, I'm not going to get into the politics of that. So the answer is we don't. You can get advice, but we actually can't even direct you. It's the law, and we do everything straight down the line. If you go to a website where they're offering payment plans, it's actually illegal. And if they do, I always say, if people do one thing illegal, what else are they going to do? So unfortunately, you would have to do your own homework on that one. But no, we don't. It's not legal. And if it's not legal, we don't do it. And Louise will come down. That'd be nice. Louise, you better remind me, because otherwise you'll just hear my jokes again, which I still find mildly amusing, but they do get it. We're a bit thin. And from Barbara, still have weight to lose, but need to rid their hanging tummy before a full tuck. Not sure. It's a bit hard to tell on a question. Even photographs I find I struggle with. I really need to see people, because in 3D, I mean, I'm a 3D surgeon, so I need to see. Interestingly, losing weight, look, there are pros and cons, and it's a big topic, so I won't go into it, but I can, if I see, I can be a little bit more specific. Where is it? There's Tricia said there are companies out there in terms of financing. There are, and certainly, unfortunately, I can't direct you. That's the law, and I do apologise, I can't. But as I say, we do everything straight, because if you go to a surgeon who does everything straight, they'll do everything straight. If they take shortcuts, then where else are they going to take shortcuts? And Trish can help you on that one. Vivian is watching. Hello, Vivian. Oh, all these nice people I haven't seen for a little while time. All right. Now, are there any more questions? I think I was just sort of warming up, actually. Probably, yeah, all right. So that might be about it. From Manda, I saw something today that a tummy tuck will no longer be covered by Medicare from November the 1st this year, when it's done with a breast augmentation. Actually, I think it's worse than that. Medicare keep changing the rules, as to the private insurance companies. And my understanding is, come 1st of November, the only people we covered for tummy tucks who have also had massive cancer reconstructions. Now, we need to clarify that, but my understanding is that's the ruling, which is nonsensical, because, I mean, to be crude, I mean, who's gone through all that is going to want to do that? So our understanding is, come 1st of November, none of them will be covered. It's not fair, it's not reasonable, it's an excellent procedure, it is life-changing. It's actually in the government's best interest, because healthier people are less using the health system, but they're the rules. It's got nothing to do with us, so come 1st November, it won't be. The question you're probably asking, though, is if an item-numbered functional procedure is combined with a cosmetic procedure, the new thing with the insurance companies is that they won't cover any of them. I mean, I personally think that's really unfair. It's wrong. You do the right thing. But what I think is, if you're not covered by your insurance company, you should go to your insurance company and you'd say, look, I've been with you for 10, 20, 30 years, and now you're telling me I'm not covered. What's the story? And if that's the case, change insurance companies. But I think they're all pretty much the same as each other. It's like Optus and Telstra. You can complain about one. Although actually they're a bit better as well. So about the 1st November Medicare change, my understanding is that abdominoplasties won't be covered except in such exceptional circumstances. It's like, is it February 29th on a non-leap year? In other words, it doesn't occur. So it's just their way of saying they don't want to do it. And I also believe that breast augmentation complications won't be covered either. So, which I think is really, really unfair. We don't agree with it. We're petitioning, we're lobbying, we're doing everything. But again, this is government, And anyway, don't get me started on government. We still live in the best country in the world, and that is true. We have the best health system in the world, and that is true. But, 20 years ago or more, when I worked in America for a year and in Britain for a year, I just thought we are so lucky in Australia. We have the best health system in the world. We have the best surgeons. We have the best of everything. And unfortunately, we're now going down that pathway, which is really sad. But that's got nothing, well, we can't do anything about that. So will the quote I originally got change as I'm getting it done in January? Manda, I don't know, but it would be certainly worth clarifying, because these rules, my understanding is the government says they're not going to do something, they're not going to do something, then they do something, and vice versa. So you will need to ring and clarify. But if you speak to one of my patient liaison, they'll give you the correct up-to-date information. So it's not that I don't want to answer the question. I'm not even sure what the rules are because they change so quickly. But if you ring up and find out, we'll tell you exactly. Is that for overseas bad surgery or even local surgery? That's a good question, Trish, and I don't know. My understanding is it's probably for any surgery. So for any breast augmentation or for any surgery that was done for cosmetic reasons, even if it's complicated, which is sort of unfair really, because, well, it's totally unfair. And just the other thing is too, and this I don't want to sound mean or anything, but we've actually put a bit of a moratorium. In other words, I've actually stopped seeing patients who have had surgery overseas. And it's just that, firstly, we want to look after people who do the right thing. But the problem is, if you go overseas and you have your surgery, then really, and I'm not trying to be blunt because we live in a real world, if the only thing that you're interested in is getting cheap surgery, then we're not those surgeons. We do things really well. We do them properly. We look after you. We provide aftercare. We fix everything. We guarantee things. We do everything. So again, I don't want to be mean and anything like that, but truthfully, if you want to go overseas, then go back overseas. That's not what we do. That's also true of certain clinics in Sydney, but that's a separate topic. So a tummy tuck is still available, but no Medicare refund. Louise, I think that is correct. Again, I don't want to give you any information that's not correct, but if you ring one of my patient liaison, they will give you the correct information that's updated, because it really changes all the time. It's really unfair because we get told one thing and then we find out without even being told that it's changed. From Amanda, what is the minimum BMI that you will operate on? I don't really take BMI too much into consideration, which is not entirely true because we've actually got a BMI machine here. We do BMI everybody, although all my girls here say that it fibs and it overestimates. So BMI is not really, it's only an indicator, it's a number, but it's really, when I've had people with, I'd say, extremely low BMIs where it's been skin only, I've had people where there was, it was mainly fat. So it really depends on a lot of factors. A number, a good surgeon, a good doctor, and surgeons are also doctors, that's our first qualification, they'll take everything into account, not just a number. We don't treat numbers, we treat people. Is it possible to have a cesarean and tummy tuck at the same time? My friend said it is, and I'm planning on having a cesarean. Thought I could get a plastic surgeon to do a tummy tuck at the same time. Look, that's a great question. I would actually say not advisable. When you're having a cesarean section, there are only two things that matter on the planet: your health and the baby's health. So for a good plastic surgeon to do a tummy tuck, and I do a lot of them, they still take me at least an hour and a half to 2 hours. It's a lot of surgery, it's got a high risk of infection, your tissues are not stable, you can't repair the muscles because they're going to be just like, stitching camembert, because they're all soft and cuttable and friable. Friable is a medical of soft. So again, if you want to remove a little bit of skin, my advice would be have your baby, let everything settle down. You've got a lot on your mind. You don't want to recovery from that, and just have a healthy baby, be a healthy mum. When everything's settled, tone up, lose weight, get everything back to normal, then you might not even need a tummy tuck. So in simple terms, I think it would be a bad idea. As part of a mummy makeover, will you perform lipo around the bum? Look, generally no, and I sound like I'm a bit of a no person, although I do have a policy. The answer to every question here should be yes. Liposuction around the body, you be very careful because you can leave saggy, droopy indents and things like that. So the answer is no. And the other thing is too, when you're on your back and I'm doing a tummy tuck, I can't access it. I can roll you over, but I would, rather than speak theoretically, how many people have I done liposuction on their bottoms when doing a tummy tuck? And I'd say none for the last 10, 15 or maybe 20 years. So the answer would be not with me. How long after a mummy makeover when I could travel back to Sydney? I'd live in Melbourne myself, but for some reason you want to go back to Sydney, good place to visit. You'd want to be around for a week or two. Travelling itself is not a problem. Flying's like driving, but just I need to look after you. I need to change your dressings. I need to give you and keep an eye on you. So most people who fly in from interstate, occasionally even overseas, they stay for a week or two. A little bit longer would be better. I mean, you could fly back the next day and if worse come to worse, fly down again. But it's an important thing. Don't rush it. Don't compromise. We don't compromise. Just do it carefully and properly. I read that even after it's a big question. I read that even after massive weight loss surgery and the strict criteria already in place will no longer be covered if two procedures done together. It's very unfair. Look, it's totally unfair, absolutely, completely. I mean, you can have private insurance, do the right thing, be healthy and try and make yourself better for 20 or 30 years and you're not covered, whereas you can get drunk or take drugs, go to a pub and get beaten up or beat someone else up and it's covered. But anyway, that's politics. And in terms of the procedures being covered simultaneously, it's not so much the simultaneous, it's the insurance companies, I think, being a bit sneaky. That if you have something cosmetic, they just sneak out of it. That's my opinion. My name, it's Craig Rubinstein, 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 Craig Rubinstein, and we are at plasticsurgeons.com.au, plasticsurgeons.com.au, or cosmeticsurgeryforwomen.com.au. So it's Craig Rubinstein. Mandy, if I needed another procedure, would you operate after another surgeon? I actually do a lot of revisionary surgery, but again, if it's Thailand, the answer is I'm not that enthusiastic. If you've had 3 or 4 or 5 surgeries by 5, I had someone who came to me who'd had, I think, 11 surgeries by 4 surgeons before she even saw me, and I thought, look, I'm not sure I could do anything. I couldn't. So if you've been to a really good surgeon, look, if you've been to a really good surgeon, you should go back to that surgeon because they take responsibility. We do. But it depends on the specifics. So I'll give you a bit of a general answer to a specific question. But yes, I do a lot of revisionary surgery. And if it's appropriate and I can help and you want me to do so, I'd be very pleased to do so. And so the answer to that is yes. And yep, so responding to Louise, cosmetic surgery for women. And Louise, thank you. Rachel, yep, so I've been told to say I think that I consult at cosmetic surgery for women in Hawthorne East, which is true. So it's 759 Burwood Road, Hawthorne East. 759 Burwood Road, Hawthorne East. It's near Campbell Junction. Private health, we'll try to get out of it all the time. I had a 3-month battle recently after saying was approved. Absolutely, we have fights with private insurance all the time. Now, I'm not saying leave private insurance or do anything, but I would do my homework, and sometimes you find you might be better off not. But anyway, I'm not advising anyone, that's not my field, but do your homework and find out who's good and who's not, because they do vary. Would you do a revision breast augmentation and a mini tummy tuck at the same time? Absolutely, if they're appropriate. It really depends on a lot of factors. But we'd have to assess whether revision breast augmentation, why I'm doing it. Is it a medical complication? Is it they're too big, they're too small, they weren't placed correctly, they need to go under the muscle, above the muscle, do they need a lift? So there's a lot of things. And a mini tuck, again, as I said earlier, I do them occasionally. I'm not a huge fan of them. It's a very specific procedure for a very isolated problem. But the reality is you still get most of the scar. I very much believe if you're going to do something, do it properly or don't do it. So the theoretical answer is yes, but it depends on factors. So sorry for giving long answers. I was just wondering if you would do surgery at the same time as a bariatric surgery. Amanda, I don't think that would be a good idea. We have very good close relationships with some excellent bariatric surgeons, but to do the two together I don't think would be a good idea. So there'd be too many other things going on. But again, it depends. It might be a more specific request than that. So if you give me a specific question, then I can hopefully help you. That's Sammy. Hello, Sammy. Do you need private health cover? No, the answer is you don't. And more people are saying, you know what, it's better to just do it themselves, self-insure. So it really depends, but the answer is no. And unfortunately, because even a few years ago we had, I believe, the best private health system in the world, but I think it's changing. Let me suffice to say that, but changing. So again, we can give you all the advice you need. We don't say do anything, not do anything. We just give you information. You can do your homework, but no, it's not necessary. In fact, more and more it's not even relevant. All right, are there any more questions? I'm just warming up. This is quite good. Well, I do have a plastic surgery dinner with my it's our plastic surgery group, so I'll get there late, but if I actually got to a dinner on time, I think they wouldn't recognise me. So any other questions? All right, it's 7:30. So I hope that was of some help. I've tried to give answers, but all of these topics are huge topics. Probably the best thing is if you want to come and see us, you'd be very, very welcome. Please ring my rooms. We do good work. We're careful. We're not for everybody. That's your decision. But I dedicated my life to this. I do more of this than anything else, which is true. So we'd love to look after you. It's appropriate. And hi, are there any surgeons covered by Medicare for health issues? Emily, it really depends on what you're doing, but really probably I have to say unfortunately no, because Medicare's just put a freeze. They don't cover. So I'd say probably no. Now Trish has to go and watch The Bachelor, so clearly she's got a better offer, which I think is entirely appropriate. From Steph, information. Thank you, Steph. I hope that was helpful for you. Julie, thank you very much. Julie, it's a pleasure. I hope that was helpful. And Amber, thank you. So said nice things. Amber, you know I'm fond of you. Well, it's actually your husband, but in that sort of professionally sort of way. But having good colleagues is really, it's pleasurable. So not everyone's the same, but there are some good people around. Actually, Amber, if you and Nick want to come to Melbourne, I'm sure we could work out something. Maybe we can come to Newcastle. What about people from New Zealand? How's it work to come over here to get a surgery done? Look, I think a lot of people are coming from New Zealand because I think the New Zealand surgeons, and I don't want to go into it because it's a bit of politics, but we are seeing more and more people coming from New Zealand. And I think the New Zealand surgeons, I'm going to be careful because they vary like everyone, but we've had a few people who've been frustrated, leave it at that. But there are some good ones there as well. Personally, I'd still come to Melbourne, but you need your information. Okay, thank you so much for your time, Tracy. It's a pleasure. I hope that was helpful. Louise is going to make a point. That's good. Hey, Kaz, nice to see you watching. All right, now, good people, I better go because I'm really going to get in trouble if I'm too late for this dinner. I hope that was helpful. There's a lot of things. All of these topics are probably 1 hour conversations. But if you want to come make an appointment, we can have a coffee or whatever, sit down, go through things. There's no pressure. Just take your time. And Amber's saying, see your breast masters. Good. I think we are all presenting there, so that'll be good. That's in Sydney. And from Kaz. All right, so good people, I'm going to call it a day because I better go. And I hope that was of help. And again, it doesn't matter who you see. Make sure you do your homework. Go slowly. It's a big decision. The best time to get things right is the first time. Best way to get things right the first time is the right person having the right surgery at the right time for the right reason. And Kaz, damn, it's too late. No, Kaz, you are always welcome and you know that. All right, so I'm going to push the finish button. I hope that was helpful and look forward to seeing some of you soon. All right, good night all. And Trish, thank you very much for organising. Really appreciated.